Covid-19 is the only thought in our minds, a pandemic that has caught the world unawares and challenging people at all levels, from scientists to the homemakers. It has brought the world economy to a grinding halt and locked businesses, educational institutions and offices and forced people to shut themselves to the world. Presently, the only way we can contain the virus is maintain social distancing, frequently wash our hands and sanitize it. But why is there an overwhelming fear surrounding coronavirus? Why fear when it's not fatal in a majority of cases? So we spoke to the leading pulmonologist, Dr. VR Pattabiraman, and this is what he had to say. It is not a killer disease, he says, but the panic lies in coronavirus, which is extremely infectious in nature, and it has the capacity to spread rapidly. This is despite a high recovery rate and a small percentage of mortality. Though we must be cautious, optimistic, and socially responsible, the doctor says that we are dealing with a new virus that appears to be stable, however. To a question if a person who recovered from COVID-19 has chances of getting reinfected, he said there is no clear picture about this. There is no evidence that people who recovered from this virus will be able to build immunity against it. It can mutate into a new strain that will change in pattern and can reinfect. Though India appears to be relatively insulated, it is too early to judge the impact, is what the doctor says. Perhaps in about 3 weeks, we will be able to know where we are really headed. In the meanwhile, we must actively support the government orders, the lockdown being an extremely appropriate measure, not despair and liberally sanitize our immediate environment. While masks could be a feel-good factor for the common man in the fight against COVID-19, its use for medical personnel is much more significant. Therefore, it's important to not deprive them of this important part of the paraphernalia to battle the virus, and it is very, very crucial to ensure its availability. The doctor says that the battle against COVID-19 is a game of blind man's buff. While we may be groping in the dark, there are important precautions to limit the spread, like washing our hands with soap several times a day, sanitizing our door handles and knobs, railings, steering wheels of our vehicles, or whatever. Sanitizing or washing vegetables, grocery packets, drinking water bottles, and staying at home is very, very important. Dr. Pattabiraman says that the symptom that we must primarily pay attention to is breathing difficulty, apart from others like cough and fever. He says that if 4% people are generally exposed to COVID-19 threat, only 15% of the elderly face the risk of contracting the virus. This statement is important as it is commonly believed that all elderly face the risk. It's important to get alert when people experience severe acute respiratory infection when they do not have a history of respiratory problems. If they have had some association with people who have tested positive for the virus or who have traveled abroad in the last 14 days of the given period, then they should be careful. This applies to health workers as well. Reporting to designated hospitals in such cases is extremely important, and it is also considered one of the best steps to fight this deadly disease that has been consuming the world. Thank you so much.